Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Delighted to be back with you for the 250th episode of the Morning Media Update. Yeah, that's what we're talking about right there. Broadcasting live with you from the Dulce Simons Family Studio, and it's a pleasure to be back with you today. And today, indeed, marks a major milestone, Hawkeye.
Yeah.
It is our 250th episode of this update. The first order of business this morning, well, normally it would be to give a bunch of numbers, but today we're going to start out by saying thank you. Thanks to all the media who have embraced this update and who put humanity ahead of competition and committed to this morning briefing Monday through Friday at 8 o'clock a.m. We really appreciate your support and your forbearance with us. This daily conference has allowed us to share important information with the community while freeing us to care for patients and to fight the pandemic. We want to thank the media for making the decision to share this program with the community over the social channels. This helped all of you watching today find us out there. We have learned a lot together through this, what has to be one of the most challenging years in our memory. You asked and have asked some of the best questions, the most challenging questions, and most importantly, you've helped spread the word on infection prevention and control and to help you keep yourselves and your communities safe. So thanks to everyone for taking this journey with us. You know, I was trying to figure out the words this morning to say. You know, I was laying in bed and, you know, my alarm went off about 5:30 and the thunder and lightning was going, and I was like, I could just sit in bed and sleep. But I was trying to think, what cool thing did I want to come up with today? And at the end of the day, you know, I wanted to be able to say, beam us up, Scotty, out of this pandemic. Star Trek reference. I wanted to be able to talk about Chiefs football, Royals baseball, sporting, the Jayhawks in the tournament. There's a lot of stuff to say. But the most important thing to say is thank you. We have a really terrific team here. This morning we have Logan and Anthony with us. Michelle's here on Jill's usually with us. She's here with us in the studio. We so appreciate Jess, Cliff. I mean, we just go on and on of all the great folks, Hawk, who support us every morning. But we also do want to say a big thanks to all of you. You know, through all this year, our goal has been to help you stay safe. Right? That's really what we've talked about all the time. How do you stay safe when a deadly disease is there that has challenged us unlike any in over 100 years? And the answer has been, if you stay true to yourself and stay true to the rules of infection control and stay true to the folks you love and the people who are around you, stay true to your bubble, you can stay safe. But it's hard, and we're hoping that we're seeing the end of this crisis. And here we are in our 250th episode, and we have an incredible program. Because to help us celebrate this day, we have two very special guests. U.S. Kansas Senator Jerry Moran has been a regular guest on this update and helped provide timely information for Kansans and all of us early and throughout this pandemic. And from Missouri today, U.S. Senator Roy Blunt, who is retiring after his current term. He makes his inaugural appearance, and we are excited about that. And we're going to hear from both of these senators in just a moment. We're going to talk about what's relevant. We're going to talk about what's coming. And most of all, two of the best things about these folks, we know we're not going to be doing any flapjack. We're not going to be flapping our arms and jacking with the truth. We're just going to be talking directly with you about the things that are going on. But before we go that direction, Hawk, how are the numbers? But wait. You have a special number today.
We have a special number, 250, as you said, but also almost 1 year to the day of our first formal update. And I think there were some images there of how far we
I know. Hey, we don't have ties on. Wait, I have a tie on in honor today, and it's St. Patrick's. You wore a green Jayhawks shirt. That's pretty cool. I don't look that good in T-shirts, so I thought I'll just put a tie on for the day. Don't worry, it's coming off later today.
That's right. We don't wear ties too much anymore.
We don't wear ties anymore. Have you missed that?
Infection prevention stuff. No.
That's what I'm blaming it on. I'm blaming it on you. It's perfect.
Yeah, no, it's good. But yeah, I mean, I think 250, almost 1 year to the day. You've mentioned all the people that help. I would like to also give this to Jill, who can't be with us today. Jill has really been proven to be the motor of all of this.
She is the motor. She may be the brains. What do you think?
I think, both.
Yeah, probably that
both.
too. Yeah,
and we have all taken on other duties. She has taken on this full duty of being able to set this up and get guests and help steer us in the right direction. So this is for Jill. It will be here, and I think the irises will be open and fragrant by the time she gets back to her office.
Thank you.
That's the best.
Thank you.
Oh, wait, we're not done.
They're beautiful.
We're not done. Wait a minute.
What?
There is also a little bobble. I bobbled that one. A little bottle of bubbly. Of course, it's. I'm just going to be honest. It may have a little alcohol content in it to say thanks to everybody. And you'll find that everybody in the program getting a bottle of bubbly today.
Yeah.
And we just wanted to say thank you to all of the team here who has made this just an amazing experience, Hawk.
Yeah.
So thank you all.
We've done a lot. We've tried to keep up with the latest data, and certainly some of our information has changed as the data has changed. But what are the things that haven't changed? The things since day one that we talked about: masking. Now, masking certainly changed from a community. It changed from being in the hospital only to the community as more information was spread about asymptomatic or pre-symptomatic people that can spread the disease. That certainly changed, the culture changed, but distancing, not meeting in groups, hand washing, hand hygiene, all of those things have really been with us almost a full year now. And I think it's helped. I think the behaviorals have helped overall. We've had a significant decrease in the amount of infections on a 7-day rolling average and on a daily basis in the Kansas City area. Unfortunately, there's a slight uptick now, about 130 cases per day. The overall 7-day average is still low, but hopefully that uptick doesn't continue and we can continue to go down or plateau. But right now, as we've said the last couple weeks, our hospital numbers have been really good. We have 11 acute infections in the hospital with 5 in the ICU and 2 on the ventilator. Still 18 in that recovery period, which is a good number. 29 total patients, and Hays has done well as well. They continue to have 3 patients, 2 active infections, and 1 in that recovery phase.
So indeed, not as good as having only 5 in the hospital. So 11 is obviously higher than that, but nowhere near 125 that we had on November the 30th. The reason is you plus science. Remember we said all along, faith, hope, and science. Those are the things that keep us safe. And you throw in a little bit of love, and man, things really work out. So this morning, let's see how we're doing. Let's first greet both senators. Good morning, and thanks for being with us, Senator Moran and Senator Blunt. We are a full year into this pandemic. Let's turn to you first, Senator Moran. What are the things that we got right from your perspective, and what are the challenges that are yet ahead of us?
Well, first of all, let me congratulate you. The things we got right is that we had 2 hosts, Dana and Steve, who are not only articulate and knowledgeable, but also photogenic, look good on camera. And so good of the 2 of you to spend time explaining in ways that I and others can understand the circumstances we find ourselves in as a result of COVID. And I think from the beginning, you have provided information that is just pretty darn straightforward. And I appreciate the capability of joining you. Yesterday was my 1-year anniversary of my first appearance upon this program. I was feeling like I was a regular until you started talking about 250 episodes, of which I've only participated in 13. So now I'm feeling left out. But before that, I was thinking like you all have been kind enough to include me and to try to bring a Washington, D.C. and a Kansas perspective. So you've done a lot right. I can't think of the mistakes at all. And I appreciate the team that's been there with you. And obviously, you're right. This dissemination of information in the absence of press and media would not be possible. And so utilizing the technology that we have to help people stay safe and to avoid as best they can the consequences of this pandemic. I too would mention Jill and Logan and Anthony, Bob, Cliff, Jessica, Nate, and Marcia. Thank you very much for providing the assistance to make this show possible. And again, congratulations to the University of Kansas Health System, its personnel, the guests that you've had over a long period of time. to try to make certain that we in this part of the country have an opportunity to respond correctly to not only protect ourselves, but even perhaps more importantly, protect our families, our neighbors, and to make certain that the right kind of information is available for people to respond to understand. And again, congratulations on the 250th program, and thanks for the time the small amount of time that you've allowed me to join you.
Well, Senator, you're very kind, and thank you for your glad tidings. You have a great and glad heart, and we so appreciate your service to Kansas and to our country. I do think you may need to go get your vision checked. Except that part about photogenic, maybe Hawkeye, but that is one thing I have never been accused of. So,
Steve and Dana, it's not even an election year, so I'm telling you the truth. They're very photogenic, the two of you.
You're very kind.
And I don't know whether you want to give me the license, but I'm honored and pleased to have my colleague, Senator Blunt, join us today.
Yeah.
As you indicated, and as our viewers and listeners know, he represents in the United States Senate the state of Missouri. And while from time to time there is some combat between our two states, Roy has been a great friend, not only of his constituents and his state, but has been so helpful to me and to Kansans in so many ways. And I would highlight that what happens, particularly in Kansas City, but what happens in our two states, they impact each other. And so it's been great to have Roy as I don't want to get him in trouble in Missouri, but very helpful to a number of causes that are important to both of our states, and particularly when it comes to healthcare. Senator Blunt and I serve on a number of committees together, but appropriations was probably the one most significant here today. And he has chaired the appropriations subcommittee called Labor H, and Labor H is labor and health and education. And the University of Kansas health system has been benefited by his leadership and support, but more importantly, Missourians, Kansans, and Americans have benefited by what he has been able to accomplish. And I'm saddened that he's made the decision to retire from the United States Senate, but his many other things will be the amount of support that particularly the NIH, and I don't want to just limit it to that, but also the FDA, the Food and Drug Administration, the CDC, the things that we've been talking about on this program in many of the 250 episodes have involved Roy Blunt and a number of our other colleagues, but Roy's leadership has allowed us to make significant strides in combating, in fighting and finding cures and eliminating diseases and afflictions, improving people's health. And from a University of Kansas point of view, I would highlight that under his leadership, we have increased the amount of spending. And in this case, increased spending is a good thing because it is a circumstance in which we're going to save lives, improve people's health, and reduce healthcare costs into the future. And that is increases in the National Institute of Health, NIH, dollars available to combat cancer, Alzheimer's, and other diseases in a very, very significant way. And in fact, we've been able to make the fiscal point known to our viewers, our listeners. We have increased the amount of money with Roy's efforts, $2 billion a year to NIH to combat those diseases. And we've done it by prioritizing that spending and not by adding to the debt, but by reducing the amount of spending elsewhere. So we prioritized research dollars in regard to cancer, Alzheimer's, diabetes. The list is long, and in my view would not have happened but for Roy Blunt. And so I welcome him. He's also been, as Steve, you may know, a great ally for the Midwest as we combat this national policy change in regard to transplants, kidney transplants in particular. And again, with Roy, the leading Republican on the Appropriations Subcommittee that funds everything that has to do with health, we have needed his help, and he has provided it gladly to the benefit of both Missourians and Kansans. So welcome to my colleague and friend. Senator Blunt and I came to the Senate together, but we also came to the House of Representatives together. And I appreciate his willingness to come and share his views and his intelligence with our press and Kansans and Missourians this morning.
Well, I'll tell you, I'll just say thanks to you both, and thank you, Senator Moran, for that introduction. You did far better than I could. I just want to turn to Senator Blunt. Senator Blunt, thank you for your service to Missouri. I'm a longtime Missouri resident, and I so appreciate, just to say, we try never to be political in this program, stay right smack on our lane, but I do want to say, I love being able to talk to people who are in the middle and can work on every side of the aisle. And to both of you, thanks to you for that. And thank you, Senator Blunt. Again, so appreciate that help. And here at KU, we do appreciate the fact that you have had a bi-state and multi-state view. What's good for Missouri can also happen to be good for Kansas City and Kansas and Nebraska and Arkansas and everybody else. And those are the kind of things that help us really move our country. And we so appreciate your lifelong service to Missouri and to our nation, and to the things that matter so much to us in healthcare. I mean, one of the major issues for you has been around mental health. Talk to us a little bit about that. I mean, no one has escaped the mental and emotional burden of this pandemic, and share your thoughts with how important that whole mental health focus you've maintained through your career has been throughout this pandemic.
Well, I'm glad to do that, and glad to be with both of you and with Senator Moran this morning. As he pointed out, we came to the House.
I think, Senator Blunt, we're losing your feed. Just a second. Let me see. I think the guys are trying to get that back.
Okay.
While we do that, I think you're back up.
By the way, is on, or can you tell?
I think you're back on now. But one thing you have to do is you have to share some really great stories about Senator Moran with us, so we have those going forward.
Now, one of the promises I had to make to Senator Moran to be on with him this morning was I absolutely would not do that.
Of course he
but
did
I've got
that.
I've got a lot of great positive stories about Jerry. And like I said, we sat together on the Appropriations Committee. We're on the Labor and Health and Education Subcommittee, which is the biggest committee in spending besides defense, and we're on the Defense Committee together as well. So we have spent a lot of the last 25 years together, I think in an incredibly positive way. Things we've done on NIH research, increasing it by 42% over the last 6 years, after a decade basically of no increase at all. And Jerry and I have been side by side on that effort at such a critically important time for healthcare. Later, if we talk about vaccines, clearly these two vaccines that were developed like no vaccines had ever been developed. But on the mental health front, I am a major advocate of treating mental health like all other health. Senator Stabenow from Michigan, a Democrat from Michigan, and I sponsored legislation in 2013 that we would do that for across the board, frankly, for Medicaid patients, particularly the least likely to have their mental health problems served by whatever coverage they had or whatever access they had. That turned out to be an 8-state pilot. Now there are 10 states that are fully engaged. Missouri was one of the first 8. So we've been involved in this in Missouri for some time, but there are 41 states now that have at least one of their major entities involved in what we call excellence in mental health. And what we've seen in the last year, of course, a huge challenge on dependency and mental health and behavioral health issues, the isolation, the new things to worry about, the fact that your support system may not be functioning the way it was, have all made a difference. Something else Senator Moran and I have worked on a lot in this regard was opioid dependency. And we engaged in that in a way that was really making changes. I think opioid deaths for 3 years went down, overdose deaths went down. Last year they went up. And when you think about it, it's totally logical that they would. So these are important issues. Let me make one other point about treating mental health like all other health. One of the things that we're doing in this now 10-state pilot is trying to keep records of the entire health history of people involved in that program. And what we're seeing is a substantial impact on their other health costs. And the two of you would know how logical that is. But if you're showing up for your appointments for your other health issues, if you're taking your medicine for your other health issues, if you're eating better, sleeping better, feeling better about yourself, the other health cost, I believe this study will eventually show, go down in more than the mental health cost add to your total health profile. And, you know, the National Institute of Health says 1 in 5 adult Americans has a diagnosable and almost always treatable behavioral health issues. So this is a big segment of the population. It's a big segment of all overall health issues. And if by doing the right thing, which is clearly to treat mental health like all other health, you actually also save money in the immediate context of healthcare. And how can anybody eventually argue against that in any state or in the country? And so hopefully that's what it's going to show. There's no question that emergency room costs are going down. There's no question that law enforcement costs are going down if they've got a partner in the mental health community that's there 24/7 to help them deal with the issues they're dealing with. So hopefully we'll continue to make the kind of progress there we've been making. But, you know, with kids not going to school, teenagers presenting at the emergency room with a mental health issue are up dramatically. Pre-teenage kids that number is up almost as dramatically. I think it's maybe about a 30%, 35% increase for teenage kids showing up at the emergency room with a mental health challenge that largely relates to the isolation of not being in school. And the number of preteens that are showing up is only slightly below that. So we need to think about all the impacts of the pandemic over the last year, and certainly mental health would be one of those impacts.
I think, Senator, I think you're right. And just to say that, yes, if people are healthier mentally, they will be healthier physically. Mm-hmm. And we see that played out time and again. We see that in things like institutionalized racism and difficulty, social, economic, and with depression. Mm-hmm. All those things clearly make a difference for all of us. So thank you for that great work in mental health. We appreciate the friendship you've extended to all of us in the healthcare community with being a champion of that cause. Senators, vaccine rollouts in both Missouri and Kansas are gaining speed as they are throughout the country. Senator Moran, talk to us about your work in helping getting veterans vaccinated.
Thank you. I have spent some time on Monday mornings and Friday afternoons when I've been in Kansas at the end and beginning of each week, visiting vaccine centers. Most recently, the Johnson County Vaccine Center in Shawnee saw Kansans, Johnson Countyans getting vaccinated in what looked to me like to be a pretty efficient system. And the pleasing part of that visit was many, as you see people getting a shot in the arm, which I think is so important to getting us back to the circumstances we want our lives to be in. But the good news, the fun part of that was asking people, how do you feel to be here to get a vaccine? And without a person exception, it was, this is so good. I mean, it's all pleasing, not much fear or concern about getting the vaccine because they see it as a way to hold their grandkids. I talked to a gentleman who hadn't been out to a restaurant in more than a year and just looking forward to going out and having a cup of coffee or a cheeseburger at a restaurant was something that he saw as so important in his opportunity to live a more normal life. So the vaccine remains important. I was pleased to see that President Trump encouraged vaccinations in his comments last night. So I think we're moving in the right direction. It always bothers me when my state is toward the bottom of the list of number of people vaccinated, and I'm pleased to see that we're expanding the opportunity for more people to show up and to sign up and to be vaccinated. And it is clear to me, particularly with the arrival of the Johnson & Johnson vaccine, that more vaccine is available. That's the part I've seen as most important in my task is to make sure that more vaccine comes to Kansas. And that's now the case. I thank you for highlighting veterans. I visited the Topeka, the Colmery O'Neill Clinic, and saw the same thing where veterans were being vaccinated. One of the things I learned in that conversation with VA officials is that a number of veterans are declining to be vaccinated unless their spouse can be vaccinated. And the VA has been incapable of vaccinating non-spouse veterans, non-veteran spouses. And so yesterday introduced legislation with the lead Democrat on the Veterans Affairs Committee with me to allow the VA now to vaccinate spouses. So we're in the process of getting that enacted into law, spouses and caregivers. And it just also makes sense, particularly a veteran who is elderly and homebound, to not have the person who is there caring for him, including his spouse, able to be vaccinated is makes no logical sense. So it is a good thing that is taking place. And I was going to look at the numbers. More than 32,000 veterans have been vaccinated through the VA for the VA that takes care of Kansas. That would be Leavenworth, Kansas City, Topeka, and Wichita, and a number of outpatient clinics. Junction City is the most recent one, in which the VA has taken their work mobily to Junction City to vaccinate veterans in that region. And so one of the concerns we've had, whether it's veteran or otherwise, is try to make sure that rural places, rural Missouri or rural Kansas, have access to the vaccine. And the VA is stepping up their game to make certain that that's the case. And they also tell me that generally they're using the Johnson & Johnson vaccine in rural areas because of the lack of necessity of the cold, freezing temperatures. So just more capable of being transported and utilized. So good things are happening at the VA, and we would certainly indicate to any veteran as well as any other constituent that if there's something that we can do to get somebody's attention to get them vaccinated, please reach out to us.
Yeah, that's true. And Senator Blunt, talk to us a little bit. I mean, the point about the vaccine getting back to normal clearly improves mental health. What roadblocks do you see to getting things expanded even further in Missouri? Your feed again. We're going to make sure. Yep, we got it. Go.
All right.
Ahead.
Talking about the vaccines for a little bit. This was a huge victory, frankly, for the Trump administration to get the vaccine developed as quickly as it did. Now, it was very much a partnership between the administration and the Congress. And again, back to our appropriating committee, we provided the money, but we also provided the sense that under the concept of moving forward rapidly with a vaccine that would be available sooner than otherwise, we were telling the administration, if you think that there is a vaccine out there that has a better than 50% chance of being approved by the FDA ultimately, go ahead and enter into a contract. Guarantee that we'll buy that first 50 million or 100 million doses of that vaccine. And if in fact it doesn't work out, we'll pay the money to see that nobody gets those vaccines that were developed. The theory being that getting not only a vaccine approved, but having it available as soon as possible would make a big difference, and it will, and it has. There's an old adage, failure is not an option. In this case, I kept saying, no, failure in this case is actually something you want to encourage because you want to be sure we're reaching far enough into the field of vaccines that everything that could be approved would be approved. So we've got 3 vaccines already. There are more coming. We did a similar sort of thing on testing. Obviously, we know a lot more about pandemic and this virus now than we did a year ago, but these first 2 vaccines developed in a way no vaccine's ever been developed before, basically telling the software in your genetic system, here's what you should be watching out for, and if it happens, here's how your system needs to react to it. That's different than the traditional vaccine designed to give you a little touch of the virus or whatever you're vaccinating against, and that becomes your future inoculation. We want people to remember that these vaccines have gone through every FDA approval step that any vaccine would go through. The difference is we didn't have 3 years of watching people who were in the study to see what would happen over the course of the 3 years. That's why we don't know for sure yet if you can give somebody the virus if you've had the vaccine and can't get it yourself. I think it's likely that we're going to soon know that no, you can't give somebody the virus if you've had the vaccine. That'll be a great moment moving forward, as we know that this would be a group that couldn't pass the virus along. We don't know if you need to have a second shot in a year or 3 years, because we haven't been watching the 30,000 people in each study for a year or 3 years. But we do know that the vaccines are safe. And we do know that, like the Johnson & Johnson vaccine that Jerry mentioned, that's a one-shot vaccine. 74% of the people in the study never got the virus. The 26% that did get the virus, nobody went to the hospital. And almost nobody had many people were asymptomatic. They had the virus, but you couldn't really tell that they had it. They couldn't tell that they had it without testing. So all of these vaccines that are out there, the 3 that are out there, you have to make a slightly different decision. If getting that one shot and having this done and having full coverage within a couple of weeks after one shot, it works for you better, that's what you should do. If you want to get one of the vaccines that appears to have a little more complete protection, but it takes 3 weeks or 4 weeks before you've had your second shot and you're at that point, you should be thinking about that too. You know, there's no federal law that says anybody has to have a vaccine, but they're safe. They will be the way we move beyond the virus. And along with Senator Moran, I'm doing everything I can to find how many different ways we can include groups and whatever group is available for the vaccine at the time. Whether that's a workplace effort, a VA effort, certainly the points he made about why veterans should be concerned about their spouses and caregivers, all makes sense. And I think both states were moving toward having broader categories of people available. And, President Biden's decision to buy enough vaccine to have every adult American have access to vaccine by the end of May, a really good decision, working with, I think it was Merck, to also produce the Johnson & Johnson vaccine, a good thing to do. I would say that if we didn't have the vaccine and if we didn't have the extraordinary effort made by the last administration, none of those things would be possible, but they are great additions to the good place President Biden found himself coming into the White House with vaccines available much quicker than anybody would have dreamed possible a year before. Now we need to make the most of that. And if we do, I'm hopeful that by early summer or certainly by the 4th of July, we're at a place where we can largely return to our normal ways we associate with each other, and hopefully have learned some good lessons in between, like don't cough on other people, wash your hands, think about your personal hygiene. Those are things that we should carry forward with us as well.
Rules of infection control. They even work in Washington, D.C. Holy cow, who knew?
Who would think? Who would think?
Who knew that? So, hey, you guys have both worked tirelessly on liver allocation and work around the organ procurement organizations, or OPOs. The Biden administration has hit the pause button on opioid reform. Eunice wants to form a task force. What do you all think? I know that's not necessarily COVID, but, man, it's near and dear to our hearts as a major transplant program.
Well, this is good news. I mean, we've had a couple of court decisions that have not been helpful to the cause, and we've certainly been lobbying the new administration to take a look. During the confirmation hearing, we've not talked about this, Dr. Stites or Dr. Hawkinson, yet, but I have added a committee assignment to my list of committees I'm involved in. It's called the HELP Committee, Health, Education, Labor, and Pensions, a new committee assignment for me. I retain all my other ones, but it's generally known as the committee that is involved with healthcare and jurisdiction, not just appropriation jurisdiction, but legislative jurisdiction over FDA, CDC, NIH. And that also allowed me to have a hearing with the nominee to be the Secretary of Health and Human Services, in which he committed, at least in that setting, to take a look at this issue in a neutral way. And I guess maybe we should set the stage for our listeners and viewers. Some time ago, months ago now, the University of Kansas Health System brought to us this issue of an allocation change. So somebody who wants to donate a liver in the Midwest, generally that liver has been made available to somebody who needed, somebody in the Midwest who needed that organ for a transplant. And rules were being changed, policies being developed that would allow distribution of those organs places outside the Midwest. And what we've seen is that places like Kansas and Missouri have a very high donor opportunity. People donate their organs to help other people. And in other places, they don't. And so in a sense, the goal was to take the folks who donate their livers and kidneys and other organs in Kansas and Missouri and make them available long distances from where the donation occurred. You all would know better than I, but there are technologically health risks associated with that, the damage to the organ and delays in the transplant. And so we would, after years of developing a policy in place, almost overnight, it seemed as if the federal government was going to change its policy. And a pause is better than a continuation, as we try to get our ducks in a row and get the right people to make the right decision in Washington, D.C.
Thank you.
And Lloyd Blunt has been the ally, as I said earlier, in this effort.
You guys have both been so good on this. Okay, so I got to first see if there's any senator questions. Gosh darn it. Any reporter questions out there this morning? Let's see if there are any questions from reporters, Jill.
Sure. Good morning. Cody Holyoke with KNBC
Hi, Cody.
News.
Cody.
Hi. Happy 250th.
Hey, thank you. And thanks for being with us so much.
Hey, no problem. This question is for both senators. I'd love to hear your thoughts on vaccine hesitancy. We're seeing this in rural counties and urban counties alike, in communities of color. Just for the viewers, do you believe people should be getting these vaccines? And what are you doing to promote vaccinations in those communities?
Blunt, thoughts about that?
Well, let me say,
We've lost. There, you're back again. I was going to say, every now and then you pop out, and there you're back. Keep going.
I absolutely think people should get the vaccine. I don't think the government should require that, though. At some future time, there may be some requirement for air travel and other things that those companies decide they want to impose, which is happening around the world. I suspect something like that could happen here. There has been sort of an anti-vax view in the country for some time now. Maybe in the last 20 years, a growing number of Americans, for various reasons, have gotten afraid of vaccines generally. That number is always going to be in the 20% category, I think, in any recent polling on this issue that doesn't necessarily even relate to the virus. I do think the gap between the 50 or 55% that were eager to get the vaccine and that 20%, we need to do everything we can to close that gap. I think part of it may be the idea that, well, this is an emergency approval by the FDA. It's an emergency approval only because the FDA didn't have the 3 years that they would normally have to answer other questions that don't need to be answered for you to know that the vaccine gives you protection right now. And let me go back to the two things I mentioned earlier. We don't know yet that if you've had the vaccine, you can't be a person who can spread the virus to someone else. Israel is more vaccinated, more highly vaccinated than any other country at this point. The early indications are there that soon may reach a conclusion that if you've had the vaccine, you can't spread the virus. That would be a good thing to know that we don't know yet. Or whether you have to have a second shot next year, we don't know that yet. But we do know that if you've had the vaccine, you are highly unlikely to get the virus. And if you do get the virus, you are highly unlikely to be impacted in a way that leads to you going to the hospital or loss of life. I think we are doing everything we can to encourage people to step up and let us get to that point of herd immunity, to where there just aren't enough people who could catch the virus for the virus to be allowed to continue to survive. If it can't spread, it can't survive. And that's why you want to have as many people as possible who either have had it and can't get it, or who can't get it because they've had the vaccine. And we're going to be at that number, I think, sometime in the early summer. But the quicker people decide they want to join the group of those who've been vaccinated and are allowed to join that group, the quicker we get there.
Moran, I know you favored the vaccine right from the start. Anything to add to Senator Blunt's comments?
Only a few things. I would say that at every opportunity, I would encourage Kansans to be vaccinated. And even if there's a reluctance on the part of you as an individual, know that it's making a difference in other people's lives. It's the same thing that we've said about mask and social distancing and being tested. Is yes, there's a component that is there to protect your health, your well-being, but the people you come in contact with, they need you to be vaccinated as well. And it gets us to a point in which, I mean, so much of what we've been focused on in Washington, D.C. is certainly the health aspect of the virus. But think of the amount of money and effort that has gone into trying to save businesses and jobs during this pandemic. And people are anxious to make certain their local coffee shop is open, make sure their restaurant is there. We fear about the closing of hotels, the airlines in Kansas. The aviation industry has been harmed because people aren't flying. All the things that we can do to protect our health also improve our economy and get us back to the point in which our jobs are more secure. People are returning to the workforce. That vaccine is our key to getting us to something much, much closer to normal, both in our personal relationships with people, but also in restoring our economy, I suppose that's a fancy couple of words for saying it keeps people secure in their jobs, because the economy is working and people are not nervous or concerned about being out and about and spending their money traveling, spending a night in a motel, going to a venue and seeing a concert. Those things can happen again with the vaccine. And I was pleased you indicated that rural and minorities. I think all of us need to speak out. I'm a rural Kansan and would encourage my fellow rural Kansans. But it's not just that. It's folks across the city. And the people I've talked to who tell me they're not getting a vaccine, some of them have already had COVID and they believe they have the immunity. Some are just waiting to see how it works. Others they're pregnant and aren't uncertain as to whether they should get the vaccine. There's some issues. Plus the things that Senator Blunt highlighted, I think he said it very well. People need to be reassured that this is a vaccine that is safe. These vaccines are safe and effective. So we have an opportunity to highlight that. And I mentioned this earlier. I was pleased to see the former president, President Trump, indicate that he'd had the shot, and it was a good thing. And I hope that that's another voice that causes people to consider this vaccination. Finally, I'd say that the sooner that Kansas can get to the point in which there's less bureaucracy, less confusion, no waiting lines, the sooner we get to the point in which people who want to have a vaccine can easily do so just by showing up. And I hope that's a matter of days or a few weeks, not a matter of months, that anyone who wants a vaccine can get a vaccine. That is will reduce the just kind of bureaucratic reluctance for people to get that shot in the arm. The shot in the arm is important to us individually, to our families, to our communities, and to our country.
And Hawkeye, yesterday, AstraZeneca, some tough news from South Africa.
Yeah, the AstraZeneca, they came out with a New England Journal of Medicine publication just showing that it's reduced efficacy for mild to moderate COVID-19. We are still looking for efficacy against severe, as Senator Blunt had said, severe disease of going to the hospital and death, but certainly mild to moderate. And they do, in the discussion, also discuss about the Johnson & Johnson vaccine that still has very good efficacy against going to the hospital, severe disease, and death as well. So we're still waiting for some of those results, but it's a brand new publication just showing really significantly reduced efficacy against mild to moderate COVID-19 infection.
And the other thing was some concern about the South African variant with AstraZeneca, I think.
Yeah, and that's what that was.
Yeah, it was the South African variant, and it was about 10% efficacious, and that's not as good, obviously. And I think the J&J was around 82% efficacious against that variant. So, yeah, that's a bit of a concern. Other reporter questions?
Yes, this is Dave Helling with the Kansas City Star. A question for Senator Blunt, and Senator Moran may want to jump in as well. Senator Blunt, as you know, there's a lot of anecdotal evidence of people in the cities having to travel a long distance into the country to get vaccine. Can you talk to us about whether Missouri has done the job it should do in getting the vaccine to the right places? And Senator Moran, as you may know, Kansas and Missouri rank in the lower third of vaccination rates, below the national average. Why is that?
Start with Senator Blunt about people in urban areas having to travel to rural areas to get vaccination.
Well, David, I'm not sure I heard the whole question that David had there. My view would be as soon as possible, we need to open the vaccines up to as many people as can possibly take them, whether that's just going down a line of age cohort or deciding that we are going to go to places where essential workers are working, or schools where teachers are either teaching or getting ready to teach. I'm not sure I heard the whole question, but I think the quicker we can open this up, the better. Our community health centers in Missouri, and I believe Kansas as well, are becoming more of the frontline place that anybody can go. And of course, they're in rural areas as well as urban areas. Jerry, you may have heard that question better than I did.
David, what I would think in your first question, I think directly to Senator Blunt, is people in the city getting a vaccine, going to the country to get the shot, where it's apparently more available. And my assumption is that goes back to what was said earlier, the previous reporter's question about reluctance in rural areas to be vaccinated. And I think it created the circumstance in which people were traveling to rural areas where there was I don't think excess is the right word, but there was vaccine available, and taking advantage of that circumstance. And again, I mean, I don't want rural folks to be reluctant to be vaccinated. I want them to get the vaccine, get the shot in the arm. But if there is vaccine that would otherwise go to waste, I'm pleased that it's getting in somebody else's arm. Every time somebody gets vaccinated, it reduces the risk to everyone. And then I am concerned. I mean, this is not a statistic that we want Kansas or any or Missouri to be at the bottom of a list. And I'm not in the vaccination organization business, but it bothers me greatly that Kansas has been at the bottom. Now I think we're in the lower 5 of number of states as far as the vaccine actually getting into someone's arm. That is explained to me by officials that's because we have poor may not be the right word. We have difficult circumstances in regard to keeping the records. But I assume that's true of other states, not just us. So I think there's an explanation that I guess we want an explanation so we can solve the problem and get more of the vaccine that is in Kansas in the arm, get the shot accomplished. So again, we're working to get more vaccine to Kansas. We're doing that with in dealing with the Biden administration, and progress is being made. More vaccines across the country is a good thing, but to make certain that Kansas, the Midwest, doesn't get left out, and that people are living in rural places have access to the vaccine. So yes, we need to do a better job of utilizing the vaccine that we have, and we need to get more vaccine available so it can be more broadly distributed and put in the shot in the arm.
Yeah, and I think just the thing from our perspective, what we've seen is that because there has been more hesitancy in rural counties and some urban areas, that people have left there. I know at least very clearly in Kansas, I know that a little better. The distribution is all based strictly off population, and nobody tried to estimate hesitancy. And I don't think we should. I think that would have been a wrong thing to do, to be that presumptuous. I think then that when you do have vaccine available, one of the problems with Pfizer and Moderna is it doesn't travel well because of all the requirements for keeping it cold. And so it's not like you could then take the vaccine and move it if you've de-thawed it. At that point, you just look for an arm to get it in. And so people would travel and go to do that. And I think the real issue for us, though, has just been the lack of vaccine. And we knew we could dress all this up a lot of ways, but we just have enough vaccine. As vaccine rolls out, increase, and to your point, I think Operation Warp Speed made a huge difference. I think that as vaccine rolls out throughout the country, I think a lot of these problems are going to go away. And our next big challenge is to convert the hesitant into the vaccinated, because that's really where we need to focus our efforts right now. We're going to have enough vaccine. Everywhere is going to have enough vaccine. We got to get people vaccinated. Senator Blunt, I understand that you have to head out this morning. I wanted to say thank you for being on our program, and again, thank you for your service to the state of Missouri, to you and to your family and to your son as well. So thank you all very much for that. So
great to be with you.
If you want to stay, you're welcome to stay. We're not throwing you off. But
no, actually, we've got another issue that, of course, really is Jerry and I have spent a lot of time on and for a decade now, but really in the last year, everybody's become much more aware of high-speed broadband connectedness, whether you're working from home, going to school at home, or telemedicine. The next thing I've got on my agenda today is a hearing on those efforts, both that we've made in the last 3 or 5 years and what we need to do now to finish the job of connectedness. And I think nothing has ever brought the attention to what we've been talking about on this issue like the last year has. And telemedicine, a significant addition in what the federal government is willing to be part of that has been out there as an option for a long time, but only in the last year has Medicare stepped up and been willing to do what they could do to make that an important part of our healthcare delivery system as well. So thank you for letting me join you all today, and look forward to more time together.
Thank you, and thanks for your support on telemedicine. Can't tell you what a difference maker that is. Just my personal appeal is, man, let's help keep it alive, because telemedicine keeps people alive. So thank you very much.
Thank you.
All right. Any other reporter questions this morning? I know we still have Senator Moran with us. Thank you, sir.
Doctor, you're going to lose me too. I'm a member of the same committee that Senator Blunt is departing for, and we get to ask questions in the order in which we appear.
So you better get going then, Senator.
He gets to go ahead of me because he left first. But it is the nature of this hearing is in the Commerce Committee. It's a hearing on how are we doing in increasing the connectivity and the speed and the availability of broadband. And that's one aspect that's related to COVID, is we cannot teach our kids by technology, and we cannot deliver healthcare by technology if people can't connect with the technology. And that's the focus of this hearing, is what's missing. But I also would say that in this COVID environment, we have changed the rules, reimbursement and otherwise, to allow healthcare providers to provide their health services by technology, telehealth, and to be reimbursed as if the patient is in the room with the provider. So there's not a disincentive to providing medical services by telehealth. And we're working hard to extend those provisions to make sure, in fact, we're working to see that they become permanent, because telehealth, not only during a pandemic, but all times, can be of great value in providing a specialist to someone who needs one, and can provide even general care to someone who needs a medical provision in rural Kansas or rural America. So in both aspects, can we connect? And secondly, if we connect, will it be paid for under Medicare or Medicaid or our private health insurance? So at work in that regard. I would mention one more hearing. I indicated I'd added a committee called HELP, Health, Education, Labor, and Pensions, to my repertoire of committee assignments in this new Senate, this new Congress. And their hearing tomorrow is, the title of the hearing is Exploring Our COVID Responses. And the committee is hearing from Dr. Fauci at NIH, Dr. Kessler from HHS, Dr. Marks from FDA, and Dr. Rochelle Walensky from the CDC. I would ask you two experts, Dr. Hawkinson and Dr. Stites, is there any particular questions you would like for me to ask those individuals, any issues that you want me to raise in tomorrow's hearing?
There is, and but first let me just say, thank you for your support on telemedicine, especially on reimbursement. We have to keep it up because it does help keep people alive. We need to keep telemedicine alive. And I know there's this push to say, well, it's a lower cost of care. Actually, it's not a lower cost of care because the cost of the technology, you still have to room the patient. You still have to do all the interviews. It really isn't. And we got lots of data to show around it. And we're having a whole session tomorrow devoted to that. So thank you very much for your work in support of that. Bless you. And I bet you can catch up to Senator Blumps. I bet you can outrun him. Thoughts about his question, Dana?
Yeah, I don't have anything in particular that I know that there's going to be a lot based on all of that issues, right, and getting back into classroom and keeping people safe and things like that. So
here's what I would say, Senator. I think what we have revealed through the pandemic is that we were a little ill-prepared around our public health infrastructure, and that statement isn't only true about COVID-19. It's really true about RSV or influenza or the safety of our drinking water and things like that. I would urge us to take the lesson that we've learned around the pandemic, that we really can make a difference in people's lives when we're prepared to reach out to them with good health care and good preventive measures. To me, that's the lesson. What we've done is we have lost a year because we weren't as prepared as we could have been with public health measures, and we had to play catch-up, and that's tough. I mean, catch-up's great on a steak, as Patrick Mahomes might say, but you don't want to play catch-up in public health. I'm pretty funny.
Thank you to you both for hosting this program and for the information that it has provided to citizens of Kansas and Missouri and elsewhere. And again, thanks for the media for covering what you have to say. It has been important and useful, and on behalf of Kansans, we are better off as a result of your programming. I worry that you're going to enjoy this so much that we're going to lose you as physicians. Please make certain that you continue to allow plenty of time to see patients and to provide health care to them. And finally, thanks to the University of Kansas Health System for their efforts in this education, but also in caring for patients in their hospitals.
Thank you, Senator Moran, and we'll talk to you again soon, I suspect. Thank you so much. All right, man. Thanks. We'll see you soon. Okay, Jill, we're way over time. Is there one important community question we should try to answer?
I think that there's some people on here that are talking about, the veterans. Kitty said that they're not getting vaccinated, as Moran said. Do you have any advice on, do you wait to get a shot when everybody can, or do you go for it?
Here's what I would say. Yeah. There's going to be so much vaccination out in the community within a matter of days and weeks. If you were here on Tuesday, you heard the senator, or you heard Secretary Norman talk about that, the thought that there will be enough vaccination for every Kansan by May 1st. I think Missouri's right around that point as well. So if that's really true, our challenge is to get it into arms because we're going to have enough vaccine. And so I think the second thing I would just offer is, so I don't think you're going to have to wait much longer. I do think you need to continue to follow the rules of infection control because we know that those keep you safe. So my advice to you is don't have a lot of anxiety about getting the vaccine because the vaccine is coming to you, because we know that in the interim we can keep you safe with the good rules of infection control. Hawk?
Yeah, just a few questions. To Senator Moran's point, I hope that we don't have to be here for another 250. I hope that the significant daily impact of COVID-19 isn't there 250 episodes from now. So hopefully we won't be there. And then on the point, Senator Moran's comments on the Veterans Administration, the VA, and their vaccination and this question, I think I was pretty amazed when we were with our CMOs and when we talked to the VA. they were giving vaccination to their VA patients who deserve it, more,
They were way ahead of us.
They were, even before our healthcare providers were getting it. So I think that was a great thing. I was pretty amazed, and absolutely, our veterans are so much deserving of that and need that. And then on Senator Blunt's comments about his science funding, I think that's important. And I think moving forward, it's going to be not just cancer drugs and clinical research, but it's basic science research to stay ahead of any potential pathogens or any potential pandemics that may occur, because we have systems out there to do that. We just need that funding. We need those labs to be funded so they can do those experiments and that research to try and stay ahead of those things. And then finally, the mental health aspect is so important. It's hard enough for many high-functioning adults to have gone through this past year with COVID-19. I can't imagine what it's like for an adolescent who, almost can barely process anything on a daily basis. So the mental aspect, the mental health aspect is such an important aspect too, and I appreciated all their comments on those topics.
Yeah, I do too. Hey, tomorrow we're going to do a deep dive into telehealth. We'll talk about supply and demand. We're going to talk about benefits to patients and providers and what the future could hold, as well as what you can do, because this is actually a bit of a tipping point around telehealth. There is some concern about whether it's going to keep getting funded, whether private insurance wants to pay for it, how it's going to pay for it. So please listen and learn and help us be part of the action to make sure that telemedicine stays out there to take care of you. Our experts tomorrow include Jason Grunstrom, our Executive Director of the Continuum of Care here at the Health System, Dr. Keith Sale, our Vice President of Ambulatory Medicine, and Dr. Philip Newland, the Chief Medical Officer at Ascension Medical Group via Christie. This is a really important conversation. We hope you can join. Hawkeye, final thoughts on this, the 250th episode?
That was it. I gave them. Hopefully, again, there won't be 250 more. We can continue to reduce the amount of infections and the daily impact, both physical and mental, that COVID is having. But it takes the continued behavioral changes and the vaccinations. And
Jill Chadwick, final thoughts from you. Hey, that's a curveball. How about your final thoughts today?
I'm just so proud of you, and I'm so proud of this community, because when I look back over a year, the credit goes first to the news directors who said, hey, we promised to make an appointment so your doctors can go ahead and do the work they need to do, and then went ahead and shared it. And then the community really stepped up, and I love how they keep you guys on your toes.
Boy, do they. And to Cody and Taylor, thanks for being with us on, and so many of the other reporters have been with us on so many of the programs. Hey, we're going to have a pretty cool closing here in just a minute. I thought about what I wanted to say at the end of this program, and I wanted to sing a little bit, but I thought, well, that's not such a great idea. I could talk about 525,600 minutes again, about flapjacking. I could talk about a lot of stuff, but the reality is there's a story. A long time ago, I was sitting on my back porch with my mother-in-law. My mother-in-law is a very wise person, and we were talking about where our kids were going to go to school, and I had all these great ideas, or so I thought. And she looked at me and she said, "But Stephen, it's really not about you. It's about your kids and what's best for them." Man, those are one of those words that somebody says, you just stop, and it stops you in your track, and you realize, wow. Well, I was right. I guess I better fix that attitude. What I would say about this program and about all of you is that it's not about Hawkeye and us. It's not all about the people in this studio. It is about you. To all of our audience and to all the people who have heard the message, and then who have taken that message and have tried to distribute it and to try and disseminate it to others. You see, that's why we're here. We're here to try and help you, and hopefully to help you help everyone else. And where would we be on our final episode? Not our final episode, our 250th episode. Not our final episode, sorry about that, 250th episode. First of all, without having said thanks to all the great folks who make this program possible, to say thanks to you for listening, and then to remind us all that we've been kept safe up until this moment and every day going forward by the rules of infection control that really do travel with you everywhere you go. Keep your distance, wear your mask, wash your hands. Remember to not go out there if you're sick, cough into your elbow, and most of all, take care of yourself so you can take care of all of us. Let's hear this final closing from our 250th episode. Thanks to everyone.
Just how long should people expect to kind of be living this way?
That is a day-by-day thing. That is looking at the data, looking at the cases.
I think it totally depends on what our response is. If it's an inadequate response, it's going to go on for a very long time. Things are changing rapidly, and we're beginning to see an increase and an uptick in the number of positive patients here in Kansas City.
Our unit has switched over to taking COVID positive patients. That was a shift just in 24 hours.
We really do need to try and stop the spread as much as possible. Today we are at 26 inpatients. We have 8 in the ICU. Today we have 20. I think we had 20 or 21 yesterday. We are back down to 10. Today we have 33 in the hospital. Today is 23 in the hospital. We have 24 inpatients in our hospital. We had 15 yesterday. Right now we have 36 in the hospital that are active infections. We have 80 total acute infections right now. 101 acute infections. We have about 122 total patients. 103 total. Under 40 total patients in the hospital.
Let me say it this way, the economy can't recover until people feel secure in their health.
The classrooms this fall and winter are not going to look like what they were in the springtime.
My husband passed away from it on May 11. He worked at Lansing Correctional Facility where there was a big outbreak.
Be mindful that this is a disease that can kill some people.
I think it's been harder on my wife than it's been on me because she was afraid I would stop breathing.
This is a liquid handler.
We're on the plane now.
This vaccine is one of the most remarkable achievements in healthcare in the history of human civilization.
Got your spot right there.
You are going to Super Bowl 55.
Oh my gosh, that's crazy!
You know what this is?
Oh my God! Yes.
As the pandemic feels like it's winding down, don't let it wind back up again. We're just going to tell you the science and the truth as we know it today. Here's what we know. The pillars of infection control go with you everywhere you are, and if you'll use those pillars, they help keep you safe.
We do put a lot of time in, put a lot of effort toward getting everybody the correct information, and that does come from, respected medical journals for our sources of truth.
Doesn't mean we have all the answers at all, but we'll always be honest with you. Remember, stay safe, and still, there's no place like home.